Epilepsy. Today we will talk about a disease which is known to man for many centuries. In layman terms, this disease is simply called fits, while in medical terminology it is known as epilepsy. Epilepsy is a very common problem in the world. Take for example, in Pakistan, millions of people are suffering from it, or maybe even more than that. It affects people living in rural areas as well as urban areas, men as well as women. The disease mostly affects young people. As an estimation, 70% of people with epilepsy are young, while 30% develop epilepsy after 50 years of age. Myths about epilepsy. Although this term is not new for many people because they have seen others in their surroundings suffering from it, but at the same time, there are many misconceptions prevalent in the society about this disease. Many people think that the fits are because of evil possession, and they then prefer seeing a faith healer for this illness rather than a doctor. Another misconception is that epilepsy is a psychological problem. People think that it is because of stress or failures in life. So when a young person has a seizure, let's suppose a 10-year-old, otherwise normal-looking boy or girl, the parents get genuinely concerned. With the misconceptions that are prevalent in society, the first fear is that of evil possession, magic, or a serious psychological issue. The other issue is that people try to hide this because they don't take it as a medical illness. They don't want anyone to know that their son or daughter has epilepsy because this diagnosis has been stigmatized in society. They may fear that they won't be able to marry off their children, or they may not become part of society, or even accepted within their family or schools. This is an example of general attitude towards epilepsy and epileptics, which is not only true for Pakistan, but also for the developed world. What is epilepsy? Epilepsy is a neurological illness, or illness of the brain. The communication or information exchange between different parts of the brain occurs through electric currents. There are billions of wires that connect billions of neurons and make this fast and continuous communication possible. If at any point in time there is a short circuit at some point, then that particular part of the brain, or sometimes the whole brain, stops working temporarily. This phenomenon is called an epileptic fit. Some of the patients may lose awareness during this time for 1 to 2 minutes. They may not respond to the bystander's commands. After the fit is over, they regain their consciousness level in the same position and start communicating normally. Sitting in a classroom, such patients may stop talking abruptly for a minute or so, and then become normal as they were, immediately once the fit is over. Patient himself is not aware of this 1 to 2 minute pause, which is obvious for the bystanders. Such an event can be called as a minor epileptic fit. If this attack becomes severe, then the patient may lose consciousness and the whole body may start jerking vigorously. It would then be called a major epileptic fit. Less commonly, these major fits may continue for hours. 90% of the time, both types of epileptic fits end within 1 to 2 minutes. Because of this, people sometimes get a wrong impression that it was their intervention that aborted the attack, which is not the case. How and how often fits occur? Epileptic patients tend to have repeated epileptic fits. The frequency may vary. One person may have an attack every month. Another will have it once in every 3 months. While a third person may have an attack every week. Some people may have an epileptic fit as infrequently as 1 in 6 months, or even once a year. Some epileptics may have fits only at night, while others may have more attacks early in the morning. This variation is because of different types of underlying epilepsy. At times, patients do not have typical whole-body jerking. Rather, they just have a sudden brief jerk, like a startle. This is also one of the minor seizure types. In the majority of the patients, an attack may occur suddenly on top of normal ongoing activity, but 25 to 30% of the patient may get a feeling that the attack is about to occur. This feeling is called an aura. Such a patient would him or herself tell you that they experience a peculiar phenomenon before a seizure starts. Some patients may even take protective action, like sitting on the floor or get away from a dangerous place where they experience an aura. 70% of the people will not get a warning, and the attack occurs suddenly. Epileptic fits are usually of a short duration. Even before you can try any remedial action, a fit usually ends on its own. Another peculiar thing is that 99% of the people get back to their normal self within 15 to 30 minutes after a seizure, as if nothing happened, or at least no permanent damage has occurred to the brain. So, this is a noticeable aspect of epilepsy, that in case of a seizure, the brain loses its functionality during the event and then gets back to the level as if it was before the fit. If a person has some or all of these problems, he may be suspected as having epilepsy. For a formal diagnosis, a physician requires training. Neurologists are expert in dealing with this disease. Sometimes, a test is done to make the diagnosis of epilepsy, which is called as EEG. During EEG, electrodes are applied on the scalp, which then record the brain's electrical activity. An EEG may show abnormality in the brainwaves, and it is then helpful in diagnosing epilepsy, or its subtype in a patient.